You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hello, this is Dr. Marzell. Welcome to my podcast of the day. Today I'd like to talk about vaginal products that are hormones for women in menopause and the package insert. This has been a huge area of concern for the Menopause Society and all menopause practitioners. The reason being that the FDA required an insert of which represents the Women's Health Initiative study. Has nothing to do with vaginal application of hormones. It quotes all the statistics from use of systemic estrogen and progestins. I'm calling this, the FDA finally got it right. They announced that they will remove the package insert warning patients of a variety of health disasters that may occur if they use a vaginal estrogen cream, suppository, or ring. I truly wish I could congratulate them on their honesty and diligence, but this is way too little and way too late. Most of my patients are very intelligent. They try to be as informed as they can possibly be, and this is an admirable trait. Unfortunately, the FDA allowed a package insert which does not apply at all to the product it represents. For those who have skipped reading the package insert on vaginal hormone products, it describes many health horrors that can result in using estrogen. The information from the Women's Health Initiative study, published in 2002, is what they used for this insert. This is a study where women were divided into three groups: those who took estrogen pills, those who took oral estrogen and progesterone pills, and those who did not take any hormone pills. Prior to this study, it was well known that when women take an oral estrogen or progesterone, it results in the liver producing more clotting factors. More clotting factors mean an increase in clots and strokes. The Women's Health Initiative resulted in noting this. It wasn't anything new. Everybody knew about it before, and they just noted it after the study as well. I don't need to go into why this occurs. It's just that the liver is stimulated to produce more clotting factors. Now, this occurs, by the way, only with oral administration of estrogen and hormones. Hormones aren't really meant to be oral, and estrogen, if it is applied topically, which most of the people who are treating menopause are treating women this way now with patches or a topical gel or a vaginal ring. These are not considered oral. And the whole mechanism of how they get in represents whether they're going to cause an increase in clots and strokes or not. Topical have been found time and time again to not cause strokes or clots. As a matter of fact, they did a couple of small studies with women who have a condition called Leiden factor 5, where they clot very easily and can have problems from that. These women were given topical estrogen products, no increase whatsoever in clotting factors or in clots produced. So if they don't have clotting problems, no one does. Anyways, the FDA had allowed the data from the Women's Health Initiative study representing oral systemic estrogen and progesterone to be used to warn women of the dangers of clots and strokes if they use along with a vaginal estrogen suppository. Studies have shown that topical application and it's in very small amounts vaginally, does not increase clots, strokes, or clotting factors. It's noteworthy that estrogen from patches, vaginal rings, or topical gel goes into the circulation first, and then it goes to the target organs, and then it goes into the liver. So a very small amount is left for the liver to process before it's eliminated. Anyways, I am a proud member of the Menopause Society, and years ago, this was brought up at one of the conferences by one of the members and said, why doesn't this society stand up and say that this warning that is put in every vaginal estrogen product is totally inappropriate and erroneous? The society agreed, and I was very proud that they sent a committee of their top guys, researchers, professors at universities teaching a variety of things, reproductive endocrinologists, and so on, to a meeting with the FDA to advise them that this was inappropriate and should be taken out. Unfortunately, the FDA refused to change the information and continued to allow women to be experiencing this fear, this inappropriate fear that they stimulated by putting this stupid warnings that don't apply to the product that was being sold. Well, they finally decided that the insert was inappropriate and now it's being removed. I am happy that they're doing it, and I don't know who has put pressure on them recently to do that. Maybe there's a new guy in town that is cracking the whip, but thank goodness, I want to say, thank goodness the FDA finally got it right and listened to someone, or someone kicked some you-know-what, to get something really going and provide appropriate information for patients who are taking these products. Please do not fear the vaginal estrogen. Hopefully you got a little information about the history of this and can be at rest and don't worry about reading that stupid insert. I look forward to our next podcast. Stay tuned and have a great day.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.